Pertambahan kes penyakit tuberculosis TB atau batuk kering kini di negara ini berada di tahap membimbangkan. Menteri Kesihatan Datuk Seri Dr. S. Subramanian berkata kira-kira 24,000 kes penyakit TB dilaporkan di negara ini.
Iaitu sebanyak 2,623 kematian akibat tuberculosis atau TB direkodkan tahun lepas, meningkat 2% atau 51 kes berbanding 2022.
Attention.
According to the World Health Organization (WHO), tuberculosis, or also known as TB, is a disease which caused by a bacteria called Mycobacterium tuberculosis, which mainly affects the lung. It can be spread through the air when an infected person sneezes, coughs, or spits. People can get infected by just breathing small number of these bacteria. About quarter of the world's population has TB bacteria in their bodies, but most do not get sick. People who get infected but do not sick cannot spread the disease. However, those with weak immune system, such as people with HIV, malnutrition, or diabetes, have a higher chance of developing active TB.
TB has long been a major health concern in Malaysia. During the British colonial era, it was one of the most leading causes of death, especially in overcrowded urban areas. Industrialization in the 19th and 20th century led to poor living conditions for workers, which increased TB transmission. The disease spreads rapidly in mines, plantations, and cramped settlements. In the 1940s, the first major breakthrough came with streptomycin, an antibiotic that changed the fight against TB. After Malaysia's independence in 1957, the government launched a nationwide TB control program. By the 1960s, the Bacillus Camle Guerin BCG vaccine was made mandatory for newborns and school children. This reduces significantly TB cases among the population.
Up until now, many TB cases have been reported. According to the Health Ministry, in 2023, Malaysia recorded 26,781 TB cases, which makes 5.47% more than 25,381 cases in 2022. The disease affected about 122 people per 100,000 population. TB death also increased by 2%, which makes 2,623 people dying in 2023 compared to 2,572 deaths in 2022. TB death rose by 12% by adding 284 more deaths in 2022 compared to 2021. This number shows that TB remains a serious health issue in Malaysia, and more effort must be done to detect and prevent the disease from spreading.
Did you know that TB is one of the most infectious disease killers worldwide? Many people have TB without even realizing it because the symptoms can start off mild but worsen over time. Realizing the symptoms early can help save lives. In early stages, TB may not cause noticeable symptoms. However, as the infection progresses, there are some common short-term symptoms that include persistent cough lasting more than 3 weeks, difficulty of breathing and chest pain, mild fever, especially in the evenings, feeling unwell and fatigued, and last but not least, loss of appetite causing unexplained weight loss. However, if TB is left untreated, it can cause severe and chronic long-term complications such as coughing up with blood due to lung damage, night sweat that drench clothing and bedding, breathing difficulties and shortness of breath as the disease progresses, chronic weight loss causing malnutrition, and organ damage if TB spreads beyond lung to kidneys, brains, or spine. You should seek medical attention immediately if you have cough lasting more than 3 weeks, you experience unexplained weight loss, night sweats, or fever, you cough up blood or having difficulty breathing, or you have been in close contact with someone diagnosed with TB.
When someone with active TB coughs, speaks, or sneezes, they release tiny droplets containing TB bacteria into the air. These tiny droplets can be inhaled by others, like Dila. And just like that, TB bacteria can enter Dila's lungs. Coughing. This is a primary way TB is spread, as forceful expulsion of air releases a significant amount of droplets. Sneezing. Similar to coughing, sneezing generates a spray of airborne particles that carry out TB bacteria. Speaking. Even with normal conversation, small droplets are released, especially if the person has active TB in their throat. Laughing. Similar to speaking, the act of laughing can expel the air out of the lung that carry out the droplets that may contain TB bacteria. Singing. Singing involves prolonged and often louder expulsion of air that may increase the potential for spreading the TB.
So, in this part, I will share some simple yet effective prevention tips to protect ourselves, our family, and our community from TB. First of all, early detection is the key. If you ever experience a persistent cough, fever, night sweats, or weight loss, you should get tested immediately at the nearest clinic or hospital because you are in the risk of having a TB. Not just that, we also need to practice good cough etiquette. For example, when you want to cough or sneeze, cover up your mouth and nose using your elbow or using a tissue. And don't ever use your bare hand to cover up your nose. Furthermore, we should ensure good ventilation. TB bacteria spread easily in closed and crowded spaces, so we should keep our home well ventilated because fresh air and sunlight can help to reduce germs in our house.
Last but not least is to maintain a good hygiene. Even though TB spreads through the air, good hygiene still matters. Washing your hands regularly helps remove germs from surfaces that may be contaminated by cough or sneezes. It also stops you from touching your face and spreading bacteria into your body. Clean hands protect you and others, especially in crowded places.
Come in.
Good morning, Doctor.
Good morning. Are you Mr. Ahmad?
Yes, I am.
Have a seat. From my observation, it seems that you have tuberculosis.
Oh,
Don't worry, TB is a serious but treatable disease.
how is it treated?
The main treatment consists of antibiotics taken for at least 6 months. This include isoniazid, rifampicin, pyrazinamide, and ethambutol. It is crucial for you to complete the full course of medication even if symptoms improve. Stopping early can lead to drug-resistant TB, which is harder to cure. You should isolate yourself for a few weeks during the treatment to prevent spreading the disease further. Good nutrition and a healthy lifestyle can help you fight TB more effectively. With proper treatment and care, most TB patients recover completely. If you have symptoms, get tested, and remember, TB is curable.
Tuberculosis is curable, and with the early detection and the right treatment, we can stop its spreads.
March 24 marks World Tuberculosis Day, a global effort to raise awareness and take action against TB. We should all join together to show our support in the fight against this disease. Every voice, every action, and every bit of awareness makes a difference as we stand in solidarity with those affected.
If you or someone you know has symptoms, don't wait. Seek medical help today.
Together, we can create a TB-free future.
Thanks for watching. Stay healthy, stay informed, and join the fight against TB.